Hello and welcome to Q&A with CNA. I'm Kyle Schwartz and my guest today is Dr. Liz Hayford, and she's been a guest several times, but it's been a while, so why don't you just refresh us about your background just a little bit and where you grew up and how you got to where you are today.
Sure. So I'm a child and adolescent psychiatrist working at CNA right now, and I actually did family medicine before I did psychiatry. And part of that was due to growing up in a small town in central Ohio, and my dad's a family doc and real old school, and so like we had patients at the house. Yes. That's how I got into medicine.
Okay. Well, describe your role as a medical physician and how that's different, at Q&A than a pediatrician would be, like what you do there.
Sure. So at Child and Adolescent Behavioral Health, I'm the medical director and primarily focus on mental health, whereas the pediatrician would primarily focus on physical health.
Okay. All right. Since you've done both, do you find one more rewarding than the other, or just in different ways there?
Different ways. I like following people's stories, and so there's actually a lot of overlap between family medicine and psychiatry, and I prefer to see people that had depression and anxiety and follow their stories over time versus like acute sore throat or stomach ache, that kind of thing.
Okay, all right, that makes sense. All right, so you primarily at the Belden office, but you also have an office here in Alliance, so tell us about that.
Correct. So we have a nurse practitioner who works at our Alliance office. I'm at our Alliance office a couple times a month. And there are therapists and case managers. We do have an office specifically in Alliance that really can handle everything that our other offices can too.
And how convenient for the people that live here.
Correct.
To not have to go over to Belden. So are there specific days that you see the clients in Alliance?
So specifically for medical, so like they might be receiving medications, we see patients on Tuesdays and Thursdays in our Alliance office.
Okay. And then you can prescribe medications. So what types of medications do you typically use?
So the most common would be medications that would address ADHD, anxiety, depression, irritability related to autism, and then some people do have bipolar disorder or schizophrenia, but that's not near as common, but we can prescribe for that.
Okay.
As well.
You mentioned some of the staff members that are here, but what are their roles? What do the nurses do?
So our nurse practitioners have a very similar role in regards to seeing patients that I do. They are able to do full psychiatric evaluation to help determine if medication would be appropriate. We have an RN who helps with all the paperwork because sometimes
it's a big part of your job.
Yes, a challenge to get medications approved. And then we have a medical scheduler who keeps us hopping. Yeah.
Keeps you on track, right?
That's right. That's exactly
All right. So if a parent thinks that their child would benefit from this, do they have to get a referral? How do they get to your office?
Yeah, they do not need an official referral. They can call our Belden office. And I'll give the number to you a couple times. It's 330-433-6075. And all they have to do is ask for intake. And then there will be a series of questions that they'll answer and get pointed in the right direction.
So no referral from
No referral necessary.
Okay. All right. Now you received a grant to help children explore how their physical health affects their mental health. What was this initiative? How did this work?
So I did family medicine before, and there is a lot of overlap between mental health and physical health. And so at each visit that I see somebody, I'm asking, how are you eating? How are you sleeping? So the grant paid for journals. So we're going to have people record what they're eating throughout the day and how they're doing with sleep and what they're doing for movement. And if we can help people make better choices like in regards to eating and prioritize sleep and staying physically active, that can really improve not only physical health but mental health as well.
I don't think people realize how much journaling really can make a difference. You know,
Yes.
you think you're going to remember this, what you ate, you think you're going to remember how much you slept Tuesday night, but if you don't write it down or keep it in
Right.
your phone or whatever, but keep a track of it, and tracking is so important, right?
Right, right. Just I think the awareness. A lot of people have an idea of like, oh, I eat okay, and then like, oh, I didn't eat any vegetables today, or I really didn't drink that much water. So we're excited to just get this going and see how it can really help people physically and mentally.
Okay. Alrighty. So again, if someone would like to have their child enrolled in this program, and how do they get a hold of you? Or
So truly the easiest way is to call our Belden office, and again, that's 330-433-6075. If they want to get a referral, ask for intake. If they're already connected, like with therapy or something, but want to get into our medical department, they would just ask for medical.
okay, good.
And we also have a great website. It's www.childandadolescent, all spelled out, and
A&D, okay.
.org, which is a great resource.
Okay. All right. Anything else you wanted to add before we close our program?
I'm just thankful for the opportunity to get to talk to you today.
Okay. Thank you, Dr. Liz Hayford, for being with us today. And thank you for watching Q&A with CNA. I'm Kyle Schwartz.